So it's very important that these dialysis patients go to their appointment on time, right? When they miss their appointment for one reason or the other, they go into the hospital when they have to supply a chair time at the hospital, which could be very costly, right? And then we're having another, which is frequent flyers because you see them in the emergency room.
Yes.
Then the next challenge is when you're going to discharge a patient, you need to have a plan of care. That means their follow-up appointments, what's going to be their end goal of getting better, where they're going to go next. Do they have the resources? How are you going to get there, right? It's like a long variation of that. And part of that is securing their chair time.
So that was in some of these roles, some of your responsibility was to secure that chair?
You're listening to Musings with Morales. Brought to you by Dialysis Education Services.
Welcome to Musings with Morales. I'm Morales, and we got actually, I got to say, I'm really excited about this episode. Have been excited since you've agreed to come on, and actually it was a reach out from one of our previous guests, Joe Rodriguez, Mirna Orihuela, very talented, accomplished healthcare leader, local here in Los Angeles, somebody that I met about 8 years ago by chance at a local post-acute conference. I was really impressed with just your willingness to collaborate at that time. And I think the impression that you left me with, Mirna, was more that it wasn't a collaboration with me, it was a collaboration towards an outcome for the people that we're serving. In your case, I think at the time it was at a behavioral health hospital, if I'm not mistaken. We were focused on post-acute issues, but again, welcome to the podcast and for agreeing to come on.
Awesome. Well, thank you for having me. I'm very excited.
Awesome. So let's kind of get to know each other a little bit, because like I said, it was 8 years ago we met. We met on a just strictly business, professional, like focused on the day that was there. That I think you coordinated the entire event. It was very impressive. Thank you. But let's leave that out for a little bit, because we know we've got that on the agenda. What got you here? So tell us about Mirna. Where did you grow up? Where were you born? What's your family background? What sort of values and traditions and folk tales did you grow up that led you to be the person that you are today?
Oh, wow. Great question. Oh, man, I'm excited. Well, I grew up in El Centro. It's a small farming town in Southern California. It provides all your fruits and vegetables for the part of California and as well other states. So since it's a farming town, there's not a lot of opportunities with work, education. So not a lot of people go beyond their high school degree, right? And making it means leaving El Centro and getting opportunities elsewhere. So we did not have a lot of that representation of people beyond a high school degree.
Gotcha.
So in the variation of that, I come from a single mother, Mexican, so I'm Mexican myself, where, again, we didn't know anything, right? First generation here in the United States, so also learning the whole, United States system, how things work at school. My first language is Spanish.
Okay.
So I had to learn English. And funny story, growing up, when I used to do my homework, I had to translate with the dictionary. There is no AI, right?
Yeah.
You had to manually translate every word.
It's crazy how easy things are today.
Exactly.
Something like that was, I'm thinking back to my elementary days, and it was super difficult for those that came in and they had the first language, whatever it was, to assimilate to English. So you had that experience as well.
Yes. My homework actually, what will take you 30 minutes, it will take me an hour or two, because I had to translate everything from English to Spanish, complete the homework. So I had to, I was determined to get my homework done, but it really gave me the foundation to be determined in general.
Yeah.
If there's a barrier or a challenge, just find a way to do it. So it just started just young.
It's like a work ethic, right?
Yes.
Just out of necessity, right?
So I've always been driven, and part of that is my mother. Like I said, she was a single mother, worked multiple jobs just to get her kids ahead. Really installed in us to dream big, do big, and do good for the community. So
Yeah.
those are the foundations where I come from. Always figure, if you want to go big, do big things, figure out.
Right.
There's no barriers at all. She's like, I have no idea how we're going to get there. We'll get there. So I've always been that person that if I want something, I'm going to find a way.
Oh, wow. Go mom. I mean,
Yes. So
that's
shout
a
outs to my
great-
mother.
Yeah.
She's fantastic.
We need to instill that, I think, because we always hear this from our elders, right? Like this generation, well, it's like a few generations now for me that I can kind of go like, yeah, we just need more of that. Like, excuse, yeah, we all have them,
Right.
And, granted, there are victims in life, but you can't stay a victim forever. You can't let them win, right? And it's not about them, it's about you, like moving forward. So like what I'm hearing is like, if you want it, you're going to make it happen.
Right.
And that's the way mom was.
Exactly.
That's awesome.
Still is.
Yeah.
Still is. She's amazing. Anybody that has met my mother, they get really inspired by. She still continued to give to their community, by the way. She was in Sacramento a few weeks ago advocating for women's rights.
Oh, wow.
So she has progressed, done a lot of educated herself to make sure that she can give to the community. So
Were
it's
you
great.
born in El Centro and then mom was born in Mexico? Or were you born in Mexico and moved to El Centro?
My mom is from Sinaloa.
Okay. All right.
So
that was
shout
going to be
outs-
my next question.
Yeah,
is where are you from?
Sinaloa.
All right.
So shout out to my Sinaloenses out there. She's born from Sinaloa, so all our family are there. I'm first generation, born here in the United States. So yay
Yeah.
to our first generation.
I mean, hey, represent yourself. I mean, first generation, and look where you're at. There are a lot of people who need to hear your story.
Yes.
And I'm glad that we get the chance to capture it.
Definitely. And, I think what the challenges are, which are many, is as a first generation, you're learning the culture,
Yeah.
right? How to Americanize yourselves, which you have to, right? You have to adjust to your culture. And during that process, you kind of, I felt, you kind of lose yourself a bit of, or when you go visit your family in Mexico, they're like, oh, you're not Mexican
different.
enough. You're different. You come here, you're like, well, you're not too American. So you're
yeah.
right in the middle of like, you're kind of lost of where do I belong?
So you can't look like your culture, huh?
Exactly.
I mean, my wife's been here for, 20 years, right? She's from Philippines. And to me, she's still like, man, she's still Filipino as like as Filipino can get.
Yeah.
But we just recently went back to the Philippines and same thing happened. Her family was like, no, you're American, right? And then her sister was born here. Well, she's full-blood Filipina, but no, they can smell her from a mile away like, oh, there's an American here, right? So you
Right.
can't look like your culture. You got to kind of have it in you, right? And
Right.
what you're saying is that American adaptation, I think we've heard that in many different ways here. Some of them from behaviors, but some of them like taking in foods even, like the way we take in foods, like so much like Mexican food in Mexico, Mexican food in the United States. Remember that, Paco? Like we had Jonathan Diaz, he's a dietitian here, and he was like, the rate of diabetes, in the United States when you have like Mexican food in Mexico and then they come to the United States and then it's like Mexican food but with American ingredients, like all of a sudden
Yes.
stuff happens. Yeah.
The portions.
Yeah.
Yeah, it's the portions too.
Yeah.
Yeah, so definitely it's a lot of adjusting. And luckily for me, growing up, there was a lot of programs in, elementary and high school, if you choose to be part of those programs, where they really help a lot of first generation Latinos
Yeah.
of what to do beyond high school, beyond your standard jobs. What can you do? How can you make a difference? How to apply to college? I have no idea. I
Yeah.
knew I want to go to college, but how do I apply? How do I pay for it? Had nothing, right? But those programs really guided you to know when to apply, what tests you got to take, what resources do I have. A lot of scholarships available. But it takes a village to give back, right? And help this young generation
Yeah.
that are learning, that have no clue of how to get there, but they have a goal.
Yeah.
And I think that kind of carries over to, in my career now, that I like to give back because it took a village for me to get here.
Yeah.
Just to get, to high school, to, college and so on. And fun fact, right? Like it took me a while to really gauge into English speaking because at home I spoke Spanish.
Yeah, it was the natural.
Exactly. In El Centro, it's a high population of Hispanics. So your primary, if you go there, everybody goes, anybody passing by?
I've been. Tell us, for those who don't know where El Centro is, where exactly is this on the map?
All right. El Centro is about 15 minutes from the border of Mexicali and about 30 minutes from Arizona. So
Right.
that little pocket.
Yep.
So if you're ever going to go to go to Mexicali for any reason, you'll have to pass El Centro.
So tell me, aside from like the demographic, that's kind of a triangle of, it would seem to be a triangle of danger. With those multiple borders and different sort of activity. Was that happening out there? Did you have different sort of activities, from just illegal activities or crimes or things like this that were associated with those three borders and people, moving around?
I felt very safe. I actually
Really?
felt a lot more safe in El Centro than I do here in LA. So it's a fairly safe community. My experience has always been safe. It is a really small town, so everybody knows each other. That kind of town. So if you're going to be doing something bad, they're going to know.
Everybody's going to know.
And they're going to go tell your mom.
Oh, wow. Sounds
be
like
careful.
the neighborhood I live in, actually. I grew up in the neighborhood with all my family. So if I was walking down the street and did something wrong, it was like somebody's going to be like, I'm going to go tell your uncle or same thing. But not a small town, but a small neighborhood.
Yes. So it's definitely very small, but to me, it was safe. And I think it's still safe. I go there, I go visit my mom, and it's a very safe. People used to leave their car, unlocked. So that's how safe they feel.
Yeah, so it's a community.
Yes, it's a community. It's majority of the people that are there are farmers, so they work in the fields.
Yeah.
So there's a lot of that, there's not a lot of jobs. So you work with the season.
Yeah. I worked with a clinic down there a couple years ago, maybe 3 years ago. And I want to say that their patient population, there were patients that were coming in to Calexico from Mexico to work and then also to get different sort of treatments and then going back to Mexico. And it was all legal maneuvering. Is there a high commuter as far as between Mexico and Calexico as far as that agriculture work, or?
Yes, there's a huge community of commuters, people that cross the border every day just to work, go back. As well, the healthcare aspect. So El Centro has now two main hospitals, one in Brawley and one in El Centro, that provides a lot of healthcare to those individuals that do cross. We used to have many moons ago, we used to have another one in Calexico, closed down for financial reasons, right?
Okay.
And that's where the issue kind of comes, where we do have a lot of people that do cross the border, get healthcare resources, but who pays?
Got you. Okay, so
Right?
they're not necessarily able to avail a payer.
Exactly. So
Gotcha.
El Centro actually a few years ago was in the verge of closing because they didn't have the cost, right? There was a lot more cost provided, and they didn't have a way to bill an insurance because they do commute for that. So they're partnered now with the San Diego, I think UC San Diego partners with them to make sure that they still have a hospital opened. Otherwise, El Centro wouldn't have.
They can't handle the overflow.
Exactly. They
Yeah,
wouldn't
yeah.
have a hospital. Like if it shuts down, then this rural community wouldn't have healthcare.
Yeah.
Right? Like any major healthcare need, they have to go to San Diego.
Yeah.
And that's a drive. That's a 2-hour drive.
Yep.
So for emergencies, it wouldn't work well.
I mean, we've come from growing up in El Centro, and obviously, I think you still have roots. I mean, obviously, there's a palpable love for El Centro and where you were born and where you grew up and the people in that area. High school, all the way through that, in that same community. How about college? Did you have to move out to do things? Because you're not in El Centro anymore.
No, I'm not in El Centro. Well, yeah, definitely. So elementary as well in high school in El Centro. Was as well very involved in healthcare. in El Central. So I was part in high school. I was a part of Healthcare Occupation Students of America, which is a national organization that really helps students understand the different avenues of healthcare. That's where I really learned about.
It's like a pathways type of program?
It's a pathways, yes. Similar to a professional organization. So it really helped me understand healthcare from a different lens, right? When we think healthcare, you think nurse and doctor. And that's all I thought.
Yeah.
Growing up, I just thought either you become a nurse or you become a doctor. But this organization in high school really opened your eyes of different avenues. There's dentists, there's radiology, there is, people work in the lab, there's administration.
So it showed all the specialty and then the infrastructure behind. I mean, I love that you pointed out the administration, because I think a lot of times we work with healthcare programs. I've worked with them over the last 15 years, like pathway programs, and that's what they think is like, CNA, nurse, boom, maybe doctor, right? I've found so much joy in other areas of healthcare besides the clinic. I love clinical too, but I found so much joy in knowing that like it takes really creative minds to navigate things like post-acute care and all of the I'll call them vendors, but specialists, right? The stakeholders that are involved in getting the optimal outcome for a patient. And then to get them to play together, right? Like, hey, I did my job. I did psychology. I did my job. I did podiatry. Well, like in the end, it's the patient in a better place. So I appreciate that you throw out the admin side, and I think it's something I don't see enough of it anymore. Like, do they still have those, pointing out the admin side of things?
Yes. Actually, HOSA, which is the Healthcare Occupation Students of America I told you about, there are a lot of those programs in different high schools, and they're getting bigger. So they're still there.
So it's not like the CTE is part of the career and technical education programs, something different?
It's something different. You have to basically implement a program in your high school, like a club.
Okay.
And you have to follow a lot of curriculum and do a lot of hours. And you actually do this fun competition once a year, and you compete with the other different chapters.
Is it like the student organization, or is it the teachers that do that?
You need an advisor, like a teacher advisor, to kind of guide all this, but it's student led.
They keep it running.
They keep it running,
Wow.
and they quiz you. So you had to learn different terminology. So from a small farming town, going and competing, I had to go compete in San Francisco. It was my first time going to outside, right? Like, oh, wow, San Francisco.
Yeah.
But also gave me a little tip of like, in a view of all these different kids come from big cities, have a different way of mannerisms and the way they carry themselves, the way they polish. It really opened my eyes of like, what a difference coming from a small town and compared to other people. So that's in high school, and as well volunteer at my local hospital in high school. So I was always been very involved in healthcare. And
why? Like, what was it that made you want to do health? Like, because it was there, or like?
Since a young age, I was always been fascinated with healthcare. It all started with hospitals. It's Doctors Without Borders.
Oh yeah.
So Doctors Without Borders used to go a lot, or they still go to Mexicali, which is across the street, across the border, and they provide a lot of surgery for the low-income communities of Mexicali. So that's actually where I learned, because you being Mexican, you do go to Mexicali a lot. You have friends, you have family, and there I really noticed how it really impacts the community that don't have those resources or are able to pay, right? Because healthcare in Mexico is different, right? I think we have it really good here.
Yeah, come out of the pocket.
It has to come out of your pocket.
Yeah.
So they don't have those resources to be paying surgeries that are needed for their children and so on. So that really inspired me.
What about like commercial type of insurances? Do they have that, or it's
They do.
just not like a national or a state level type of insurances?
They do have something like government, but you still have to pay, right? But they don't have those.
It's a small percentage.
It's a help. Yeah, it's a help.
Yeah.
But that really inspired me. Those Doctors Without Border really inspired me to be interested in healthcare. Now, that's where I started with, maybe I should be a doctor or a nurse. And it progressed, and it really opened my eyes as I grew older, was more involved, learned the different avenues. And then that's when I started transitioning to college, right? I started applying to programs that had like nursing degrees, healthcare administration. And just making that jump was I was excited because like I gotta go do big things for my community. And to be able to do that, you had to take a leap and go to a different city. And I went to Cal State San Bernardino, so shout out to all my Yodis out there. And it really opened my eyes of how a big city is. Like, although San Bernardino is not a huge city, to me, it was a big city. Yeah. I went from eating just Mexican food at home to exploring different food. I didn't know about Thai food, about other variations of food, different cultures. It really opened my eyes, and I had to, just not adjust, but learn. And I was so curious about different cultures because I wasn't exposed to that in El Centro. But my journey continued in college, and I think one of the things that I admired about my mother during that process of college is for a second I thought of not going to a 4-year college because I didn't know how to pay for it. And she told me, do not worry about that. We will figure it out. But you apply and you go. Just
like what you said in the beginning. It's like you want it, it's going to happen.
It's going to happen.
Make it happen along the way, right?
Exactly. Yeah. And everything just unfolded.
Yeah.
Right? I got a scholarship from Cal State.
I want to meet your mom. Yeah. I mean, like,
she's awesome.
So many people in business need this, like over the years, sorry, I'm taking it to bit, but so many people over the years that I've worked with, been friends with, thought of doing things with or done things with, right? It's like they're so risk averse because they think that you have to have everything figured out if you want to make it happen. And I mean, it's good if you have it all figured out, but you really don't, right? Like when you actually go and do something, you can plan. And I think that's something we should all do. But your plan is never going to be the actual blueprint of what happens, right? So you're going to have to pivot. You're going to have to adapt along the way. Hey, if you really want it and you don't have any idea how to get there and you're willing to take those, take those leaps, and you were young.
Exactly.
Like, why not, right?
Yes. Shout out to my mom. She's awesome. But yes, I moved forward and everything just unfolded. I figured it out. And here we are in college, learning everything, and started my journey there. But joining American College of Healthcare Executives in college, which is ACHE, really pivot my career. So ACHE is a professional organization in healthcare. This is open for students, professionals, and it really helps you navigate healthcare with educations, pathways, and resources, networking, you name it. So me, little Hispanic, young girl, didn't know, I want to be in hospital. I want to dream big, but I don't know how to do that. How do I get there? I have no idea.
I love what you just said. Yeah. Dream big. Like sometimes you got to be taught how to dream big, right?
Yes.
I know I did. You got to watch and learn, right?
Definitely. Yeah. So ACHE really took me under their wing, like many students. And there's many students that are involved. And if you're a student hearing this, please join an organization that, it's part of what you want to do in your life, or ACHE if you're into healthcare. But they really took me under their wing and helped me navigate of who to talk to. What are my options in healthcare? What jobs can I apply to? How do I get into healthcare? And when we think healthcare, we only think hospital. Yeah. Right? But there's so many different avenues outside the hospital. Yep. That we don't know about. I did not know. And I learned, right? And that, but ACHE has been a great foundation for my career because I met a lot of great mentors who guide me, sponsors who advocate for me for, positions, opportunities. And that's what we all need. We need sponsors and mentors. We need to give back as well. So I like to give back.
It's loud and clear. I mean, we see it. I'm local, so we know the same people. And every conversation that comes up when it comes to bringing the community together, and I will not say an entity, I'll say the community, right? You're like front and center, probably organizing the entire event, speaking, being acknowledged for something. So tell me about some of these recent acknowledgments, because there was a recognition as like a volunteer in healthcare, and then a more recent, which was, I'm guessing, kind of a bigger recognition or something, but like you're actually somebody, a woman of influence in healthcare. So can you tell me about kind of the recognizing organization, what led to those acknowledgments, and how do you carry the torch now after gaining so much accolades?
Right. Well, let me start with the Healthcare Volunteer of the Year. It's contributing to all the work that I've done to giving back to the community in different platforms. So one of the platforms that I, was involved a lot was providing clinics to the community of Long Beach that, we did to, we will partner, for example, with shelters to provide clinics, get their annual evaluation. They don't go to the doctor very often, right? So you provide those clinics to those, homeless people of the community.
So you bring it to them.
You bring it to them. You talk about resources. And in those opportunities, you get to speak with some individuals. Some individuals are not homeless, right? But they do come to these clinics.
Right.
And what they're afraid of is when you tell them that, hey, come follow up for an appointment, they're scared to provide the information because they might be, for example, undocumented.
Right.
And be like, this is free.
Yeah.
We just, want to help you. So you kind of have to have kind of put yourself in those shoes to provide those resources and provide them. Another thing too, when I was helping in the Compton area with some clinics during COVID, providing those COVID vaccines, is some of them felt like, oh, I feel so ashamed because I can't fill these forms because I don't know how to read.
Yeah.
Right? It's like you have to connect with them and be like, it's okay. We're here to help you.
Yeah.
We want to make sure that you get the care that you need to be okay.
So were these considered like part of wraparound service clinics, or what was the primary need of these individuals? Was it different things like some shelter, some...
It's different needs for all of them, right? So Long Beach, we're going into the shelters that a lot of them don't have the resources. They just need to figure out, just stabilize them in some way or the other. When for the during COVID, when we did the vaccines, is more vaccines, providing those vaccines to the community during COVID. So that's some of the things I do. And as well, I did a lot of, this is where we met, a lot of symposiums and events to educate the community about post-acute.
I still have pictures from that thing because there was quite a few things. I was like, I don't know that.
Yes.
Like, let me take a picture of this, right? I was new to nursing homes at the time, so well, right on the hinge of that, I guess. So
there's a lot of information that we need to give to everybody to educate yourself, because why keep it?
Yeah.
If you know me, if anybody engaged with me, as I don't keep no information, I'm gonna share it, right?
That's what it's for. It's not for you, right?
Exactly.
It's for somebody else.
Yeah, it's progress. So a lot of those, conferences that I do, targeting, specific goals we want to reach, as well. Putting together the board of governors. So if you are working to become a fellow with ACHE, we provide 5 Saturdays where we teach you about different levels of healthcare. It's basically how to run a hospital.
Oh wow!
And you are able to pass your exam and become a fellow. So it's one of the highest achievements for a lot of executives.
So I got to tell you, when I went through my graduate studies, like I was being courted in a way, or kind of like, hey, come on. And I felt so intimidated, but I just thought it was something totally out of my reach, right? So never touched it, but I was always like, I want to, like, that seems cool, right? Because I used to like to put things on the end of my name, right? So I was like, oh, what is it? FACHE, right?
Right.
And then 2000, 17 or so, I met one of our mutual friends, Mike Lee, and I said, "Hey, you're that, right?" And he's like, "Oh yeah, I'm really active." And he's like, "You got to get in it." And even recently with a company I'm engaged with, we were kind of looking at the local chapter, and I was like, "Well, we're not ready yet." And actually, to tell you the truth, some of my leadership was like, "We don't know much about them yet, so we need to know more." We had Joe on a couple weeks ago, and then recently he told me, like, "Morales, like, I don't know if you know about this, but you need to get active." I think I've been feeling that. I've been having that magnet effect towards the organization, but with Joe and you, and then all the, now Mike's on my shoulder in the back of my head, you're going to see me there soon. So
Definitely do it.
I got the link for membership there, and we can touch base on more information there, but I'd love to see some of the audience there, because I know a lot of our followers are also in the similar positions as you and I, as far as our interest in the healthcare field, wanting to see good outcomes for the people that need them most, the patients, but also understanding that there's also like a benefit to you as a professional, and you're the ladder that hopefully we're gonna, I guess we're hearing about now, right? From high school, and the high school interest, being inspired from Doctors Without Borders, right? Going into the college and then becoming part of professional organizations, and then let's kind of catch up now. Like met you at the post-acute conference there, but let's say college forward. What's been your trajectory, or kind of the starting place and the stepping stones to where we're at now?
Definitely. I started in home care. My first job in healthcare after college. And I think when we all dream, like I said, healthcare, you would think working on the hospital side, right?
Yeah.
But you never, I was like, home care, what is this? But as I learned about home care, I learned that's an up and coming, niche.
Yeah.
And that's really where I started with my post-acute journey, home care. And with the variation of ACHE, I network. I was telling people about home care. I was learning about different aspects of the continuum of care. Right? That's where I started digging.
Let's open that up a little bit. When you say home care, what do you mean home care?
Home care there's home care, right, and home health.
Okay.
So home care provides a lot of your daily living activities at home. And home health provides that, plus you're more medical, right?
Yeah.
You're going to have a nurse, you're going to have an LVN check on you to make sure that you are taking your medications, that everything's okay, checking your vital signs, your wounds.
So let's start with what's the type of person who needs home care?
Home care?
Yeah.
Someone that needs a little bit more help with, let's say, your daily activities of getting dressed, bathing, doing some chores around the house, making sure that you go to your doctor's appointment. That's someone you need. Someone they're okay on their own. They just need a couple hours of that help.
So I got a grandma. She's pretty severely demented, right? She's worked her whole life. She's got insurance and means and stuff like this. She lives with my parents. They're still able to help, but she's severely demented. Should she have home care? And then with home care, is there a coverage for that from an insurance perspective, or is it something that I need to come out of my pocket?
So home care, it's a little more private pay or long-term care insurance. So if you are young, you get your long-term care insurance. Well, it's cheaper.
When all the financial people tell us, "Hey, you should be doing this," and we're telling them we should be doing that.
Yes.
Oh, okay.
Absolutely. It's going to help you in the long run.
Yeah.
Right. Get it while you're cheaper.
So we need to connect you to financial, because you're now evangelizing for them.
Yes. Shout out, Sarah. But yeah, it's home care. So they'll benefit for that, to make sure that she's having her medications, right? Because she might forget.
I didn't know that. So home care for ADLs, long-term care insurance will cover that.
Yes.
Nice. Okay.
And then you have your home health, right? You with Medi-Cal, Medicare, if you're a private insurance, other insurances will cover your home health.
Yeah.
You're gonna need a doctor's order. You're gonna make sure that, you're gonna have to have 3 visits if it's checking about whatever it is, if it's wound care, if it's you have diabetes, if you have a heart condition. So now you're talking more medical.
So a lot of the discharges that you've worked with over the years end up with some sort of home health.
Home health, yes.
Wounds, diabetic management.
Exactly.
What are the most common things that you see for home health needs on discharge?
I think falls.
Falls. Okay.
Yeah. Falls, people that have come to the hospital and they are COPD, right? Diabetes.
Yeah.
Some of that. That's where you have the variation of home health, home care.
Yeah.
But you're going to see a lot of home health when you're coming from the hospital.
So if I were to say PT, is that home health?
You can get PT in home health. And you can get another variation. Now,
So what's PT, by the way? PT is physical therapy, right?
Physical therapy.
Okay.
Yeah, you can get physical therapy in different levels. This is where it gets fun, right? This is where educating yourself about post-acute and the continuum of care really helps, because not only can you get it in home health, you can get it in other areas. You can get it in a skilled nursing facility. You can do it in a long-term care.
Yeah.
And it varies on. It just depends on the intensity that you need it and how often, because every single layer requires you a different requirement. Like home health might be like 2 hours, right? A skilled nursing facility might require you to do it 4 hours a week or something, multiple days. Long-term care hospital is going to require you to do it more intensively.
Yeah. Yeah.
So they all require.
And why is that? Why is it that they'll do it more intensely?
Because their goal is to achieve something differently, right? If you're going to go, for example, into a LTAC, long-term care hospital, those are people who are going to be there for 25 days or so.
Right.
You need more intense activities, more routines, more people checking on you, because you need that much care to reach your end goal of going home.
So it's about the discharge.
It's about the discharge that's most appropriate for you.
Yeah, that's important to say.
And then I think what a lot of us struggle, right? Whenever you have a parent at the hospital, or you're at the hospital, or a loved one in the hospital, and you're getting ready to be discharged, you want that patient to stay home, right? You want to I want it, for example, I want it to stay at the hospital because it's the safest place.
Right.
But it's sometimes not the best.
Yeah.
Sometimes the best is for them to go home or to a different level of facility that is appropriate for them, that they will have the required nursing people there, the required, therapy for them. But it's always the goal of post-acute in the continuum of care is moving the patient along, that helps them moving along very smoothly and safely. So you're always stepping down, right, in levels.
Yeah. So you started with the home care side of it, but you've moved on to more post-acute. What are the other areas that you've dabbled with, or I shouldn't say dabbled because you've conquered them.
Yeah. So working at a hospital here in Long Beach, really was able to learn about the different levels of home care, post-acute, skilled nursing facility, home health, hospice, you name it. But it really opened the opportunity to get into a skilled nursing facility training program. You know?
Yeah.
So a lot of people have to go to a training program, take a test, and become a nursing home administrator.
Yeah.
So I dove into that. Not to become a nursing home administrator, but it's honest. Like everybody who does it, kudos to you guys. It's a lot of work.
I had hair before that.
Yeah,
I did.
It's a lot of work.
I mean, I didn't. I still shaved it, but like I could have grown hair before that. And once I did that, it was like just, man, went right. Yeah, you're right.
Exactly. It's a lot.
I say the same thing. Anybody who can do that and for more than a short period of time, and that's like their career, like, holy crap, they're, man, super person, right?
Exactly.
Like, how do you, it's 24 hours, right?
It is 24 hours, and you're responsible for the whole show.
Yep.
But it really, having that training really helped me understand how to bridge gaps.
Yeah.
So working from the hospital side, I was able to better understand the need of my post-acute, like my skilled nursing facility, and communicate that to the hospital.
Yeah.
How to improve that communication, that partnership, and as well for their patients, right?
Yeah.
Because, for example, our hospital, we want to discharge.
Yeah.
We want to discharge, but are we discharging at an appropriate time?
Yeah, we don't want to readmit, right?
We don't want to readmit. And another thing, too, as simple as we're discharging this patient expecting the skilled nursing facility to accept the patient during a shift change,
Yeah,
right?
yeah.
That's not possible.
Yeah.
But if you don't know that,
Right.
you don't know.
You're just ringing the bell. Like,
Exactly.
Yeah.
So it's like smoothing that transition for the patient makes a better experience for
Yeah.
everybody, and as well for the family that feels comfortable as you're transitioning to different levels of care. So that's another aspect of how I learned about post-acute, and then as well just learning.
Yeah.
And I'm not afraid to learn. And if I don't know something, I'm going to dive into it.
Yeah.
I'm going to dive and learn and be comfortable.
You ever have
speaking
to
about-
fake it?
Fake it?
Yeah. Would you? like, I know what I'm doing. Like,
I think everybody that has ever approached me or worked with me at some point, I'm comfortable saying, I don't know, but I want to learn.
so let me
Yeah.
put you on us, because I want to know if I dealt with this stuff right. It's
Yeah.
like as an admin, right? So I got through into this
Mm-hmm.
like literally by fire. I'd never touched post-acute outside of, I've only touched dialysis when I took this thing over. And I went in to bring in dialysis to a nursing home. They were like, get out. But they called me back a couple weeks later and said, can you take a look at our financials, help us out, and maybe you can just run it, right? Mm-hmm. But the thing that I think, maybe really prepared for, or just not mentally prepared for, but like I was the right person for the job, was families. And like, I found myself in a position where I kind of had to like say the right thing. Mm-hmm. Like, I don't remember a time where I said like, I don't know. Like, I always had to kind of seem like, because who else?
Right.
Right?
Yes.
I might have had to like kind of wing it and then go talk to nutrition, or, talk to, was that MDS, or what was MDS? Material data, I forgot, minimum data sets, MDS nurse, right? So I might have to go talk to somebody. Yeah. See, that's how good I was as an admin, right? I didn't even remember the damn department names, right? But, but with the patients and their families, like, I was the go-to.
Right.
And so, I mean, how did you respond to those sort of, or did you have those sort of encounters where it's a patient effect? Because for me, day number one, I walked in and I was like, family, hey, can you go handle this? The owner, can you go handle this? You're here now, so
Yeah.
go do it.
I deal with, in post-acute, you're going to deal with families.
Yeah.
At different levels, right? All of my experiences with post-acute is connecting with a family member or a member or a patient at some point.
Yeah.
And a lot of that is just feeling compassion and putting yourself in that shoes
Yeah.
and be like, let me find out. I think as long as you tell them that you're going to find out
Yeah.
and you follow
Agreed.
up, they feel comfortable because
Yeah.
they just want to be in the loop.
Well, that's solid for anybody in
Yes,
healthcare. Nurse,
exactly.
tech, CNA.
Yes.
As long as you cannot like let a need go void, right?
Right.
You leave a need, it's like kind of like leaving pain, right?
Yes, yes.
Like not addressing pain.
Exactly. And I think a key element of a successful care continuum is that communication,
Yeah.
right? Because you're
Yeah.
communicating with the member, with the family,
Yeah.
with providers, with the next step in post-acute, if that's a home health, skilled nursing facility, wherever you're going to go, and facilitating that. And we think that's easy and that's happening, but you really need to have a strong partnership for that to happen and feel
Yeah.
comfortable
Agreed.
of opening that communication. It's trust, right? With families, they want to feel comfortable that they can trust you, that their loved one is going to be okay, they're going to have taken care of. And as well, it's a scary part. I
Yeah.
think everybody is scared when they leave the hospital and they're moving in this transition. So
Yeah.
building that trust with a family member is important.
Agreed, 100%. Okay, so where are we at in the trail of growth here? We're at the kind of, I think we're describing an AIT program,
Yeah.
administrator in training. Where'd you go next? And I think it's all kind of stayed to the same niche of post-acute, right? And
Yes.
transitional type of activity.
Yes. So after my AIT program, I still had a goal. It was to learn, to better understand these gaps. It really helped me as well develop educational events like the symposiums,
Yeah.
educational events to teach about post-acute and those partnerships. But it really helped me as well, help other people about developing partnerships with their post-acute care providers and building a community where we all help each other. We're not in competition. There's plenty of, there's plenty of food for everybody to eat.
Yeah.
Right? So how can we work as a collaborative community in post-acute to help our members? 'Cause that's our goal, right? Because you might have a specialty in your, for example, your hospice that can take dialysis patients.
Right.
Another hospice might be a better suit for something else.
Yeah.
But if you don't know and you don't work as a partnership, you don't know, right?
Yeah.
So it really led me into just advocating for that partnership.
I was going to say, it's like, how can you advocate if you don't know? Right?
Exactly.
I mean, somebody's got to know.
Yes.
And the example you gave there, we talked about that with Joe, is like, I ran into that. Like, hey, we've got a ESRD patient, but also they got some form of cancer. Their diagnosis for hospice is cancer. They want to keep doing dialysis. And everybody keeps telling me that if they want to enroll them in their program, they got to come off dialysis. And the patient's going like, aside from what the doctor told me, I'm fine. He told me it's terminal, but I don't want to like drown in fluids and be miserable, right? Like coming off of dialysis is hard if it's not conservatively managed. And even then it's a terminal pathway, right? So we ran into each other, behavioral health, like same thing, discharging unique needs there, right?
Yeah, so working in a behavioral health hospital. So this hospital is acute and behavioral health. So you get a really interesting mix of individuals that need acute care, right? Hospital care, but also have a behavioral component of it. And they face challenges of what kind of resources are out there in post-acute, right?
Yep.
And it kind of helped me understand that there are post-acutes out there that their niche is behavioral health. They will take patients with behavioral health.
And there are places that should never touch a behavioral health patient.
Exactly. There's some of those. So that way kind of going back to it, finding the appropriate place for a person. Because every journey is very unique.
Right.
They will have different needs. That is their medical need, their financial need, their insurance need, anything.
What about like proximity to family and things like that? How important is that in post-acute, especially with placements and things like this? Because I know that when you talk about financial, like just so many variables to it that like I was here pretty close to this building when I was running a nursing, and I'd have patients that sometimes, man, they just shouldn't have been there. There's got to be something closer to them, but for one reason or another, they ended up at this nursing home. Yes.
So when I worked in another hospital, so I went from a behavioral health acute hospital that was for-profit. I transitioned to a non-for-profit community hospital. Okay. This is just acute. Yeah. It gives you a different lens, and you experience different kind of patients and different needs, and the goals are different. There, I will see a lot of examples where family wanted their family member to be discharged somewhere close because they didn't have a vehicle. It's like, how many buses is going to take me to see my grandma at a skilled nursing facility? Right? So a lot of those decisions happen based on that proximity. Yeah. And as well, then it kind of limits of what kind of insurance would they have that can cover the options that we have. Yeah. And as well, the bed availability, right? And some skilled nursing facilities might have a bed available, some are not. Do they provide the need that they need? Right. The services that they need for this patient. So sometimes the services that you need might not be close, and you have to provide them with a resource that's further out for them. Yeah. And that makes it challenging for the patient or the family, right?
The whole support network.
Support network is not there. Yeah. Or they have to work, and now, they're not going to make it there in time. So then that puts that pressure of, being away from home. Yeah. But it gives you another opportunity that it doesn't end at a skilled nursing facility. You can step down, even you can be discharged to home and with home care, right? Going back to that. You can get home health. There's hospice. There's a whole new model now with care at home, care at home. You can provide all the resources at the comfort of your home, which is actually better for the patient.
When you say care at home, is this an entity-specific thing, or is this like a modeling from a
it's a new model.
payer?
It's a new model that a lot of hospitals are being focused now because it is moving the patient at home and providing everything that they need at home. You can even get dialysis at home, right?
Well,
with
we're going to
this
go
new-
there for
Yeah.
sure. 'Cause, I mean, we want to talk complexity, right?
Yes.
Like now you got, I don't know, it might be the cream of the crop as far as complexities go because you're loaded up with so many comorbidities
Yes.
with a dialysis patient, right?
Definitely. So this model has been discussion for a while, but it really got a push during COVID, right? When there was limited.
As it should have, like,
Right.
especially with a dialysis population.
Yes.
But any community type of clinic, right? Nursing home being another one, right?
Yes.
Like we wanted to get people out of nursing home and back into home care, right? Were you going through a lot of that?
Yes, during COVID, I think we all faced with a lot of challenges. That's one of them. That we had to think outside the box of how can we provide care with challenges like the nursing homes are shut down because an outbreak.
Yep.
And having those conversations with family members of you can get this care at home, right?
Yeah.
For example, we faced a lot of hospice patients that the family wanted the hospice, their family member to be in a skilled nursing facility with hospice.
Yeah.
But there's no beds during COVID, right?
Yep.
It's locked down.
Yeah.
But you can get those services. You can get hospice at home.
That's right.
Right.
Yeah.
But having that education and that comfort, right? It sometimes is a challenge.
Yeah.
Because they're not. We need to do a lot of education, and I think the challenge is when you get to post-acute, especially hospice, you have to make decisions quickly.
Yeah.
And sometimes they progress, and by the time we make the decisions, it's a little too late.
Yeah.
And I think hospice has a wonderful resource, not to just the member, like the patient, but to their family.
Right.
Right. They follow up with you after to make
Yeah.
sure you're okay. They follow with you up to a year or more.
Yeah.
To make sure that you are doing
Bereavement
okay.
and all that, right?
Yes.
Yeah.
So it's a lot of wonderful resources that sometimes we don't know, right? That
Yeah,
we
yeah.
all need to educate ourselves, especially when that time comes and we have to make decisions about post-acute, we have a good foundation because those decisions do come quickly.
Yeah.
But going back to the care at home model, it really got pushed to during COVID to provide care at home. A lot of hospitals are opening up their own program, care at home. So providing the care at home. We're talking about dialysis at home. We're talking about having radiology go to your
Yeah.
to your house.
Yeah.
Making sure your doctor is checking on you.
All the
at
mobile
home.
stuff
All
was
the
really
mobile.
hot during.
Yes.
And I mean, are we still seeing it out there?
We
Did
are.
it die down or?
Well, I think one of the challenges that we're still facing is the funding. Like there's a lot of hospitals that model is thriving because they have a good financial funding, right? There's some way they're able to pay for that.
Yeah.
Some other hospitals are a little struggling of that financial, how we're going to make that happen because paying, right? The
Yeah.
payment of it is
Yeah.
a paying model is a little bit challenging. We need a lot of backing from insurances,
Yeah.
from other places to
Yeah.
make sure that they will pay for that visit.
Yeah.
But it's definitely going there. If you're thinking of what's the next thing in healthcare, innovative, you want to jump in early on, home care, care at home is one of them.
Wait, I got to ask you this. So we've talked about payers a little bit, and you mentioned Medicare, Medi-Cal. There's a lot of patients that are now being gobbled up by the Medicare Advantage programs.
Yes.
And we're starting to see more of a value-based approach towards care and thinking about continuum of care, like, hey, get it right or, take the risk, right? Take a risk, take a reward, but you're going to get it right, if you opt into this, right? And then there are even mandatory models for value-based type of care, especially in dialysis, with home dialysis specifically, right? But, what are you seeing from like the full continuum of post-acute care, discharge down? Are we seeing these Medicare Advantage or any sort of value-based care have an impact? Are people starting to play together differently? I know rates are adjusted, but then there's a win on the other end. Talking about care at home, sorry, I'm throwing a lot out there, but staffing and thinking about like a service like dialysis, right? patients who go do dialysis at home, the model that we've had forever has been like, Mirna, we're gonna teach you how to do it, and you're gonna do it yourself, and then your spouse or your brother or your cousin or whoever, your neighbor, is gonna be there with you like a care partner, right? So it's meant to like teach you how to do it, then you go do it, and we'll manage you. Well, that really prevents a lot of people from actually being able to go home because maybe they don't have the care. I mean, you talked about literacy,
Right.
Language barriers, aptitude. You know what I mean? That could be a challenge in doing home care, right? So we're starting to hear dialogue of payers that will actually add on and say, hey, we'll throw in some money for staff to be able to provide a staff to do these sort of things, whether it's dialysis or another thing. Are you seeing creative tactics like this? Have you seen any outcomes, and anything you can opine on as far as that approach?
I've seen a couple of different models out there, and definitely it's like there's their positives and your negatives, right? It makes it challenging sometimes for a post-acute to really provide that care to someone that needs it when it's limited.
Yeah.
Right? It's like you're only limited to 3 visits when this patient might need a little bit more.
Yeah.
Right? What is appropriate? I think that is where you kind of play like, what can we do to make this happen so this patient it's okay, right? Our goal is always to make sure our patients are getting better. But that educating the family member, it's going to really help to make sure that they kind of follow through to some things that they need. But it is a challenge.
Yeah.
It really is. Do I think we can get there? I'm a true believer that you'll find a way.
Yeah.
But it's definitely moving more and more towards that. As we saw during COVID, financials really hits us, and we have to be creative with everything we do.
Yeah. I'm going to backtrack a little bit. So you mentioned some of the challenges or the perceptions that communities might have towards getting care and follow-up.
Yes.
I have a little bit of experience with that in the COVID operations when the first wave, and we set up big shops, our mutual friend and I, all over Orange County, San Diego, Seattle, a lot, right? And we set up in some areas that were, Santa Ana, Paramount, Commerce, areas that were predominantly Hispanic, Latino. And Santa Ana, at a certain point, was the highest number in Orange County, but we couldn't get anybody to go test there. It was like our lowest testing site, right? And a lot of it was exactly what you said. I had an ice cream man pull up one time, and he's like, hey, he's telling me, he's speaking in Spanish, and he's like, do I have to show my papers? Am I going to get in trouble? I need to get tested. And I was like, you're good, brother. Like, he didn't do it still. The only way that we had any penetration was when we partnered with school districts in those same areas, and then we educated the children, and they went home, and what did they do? They translated for parents, they educated their parents. Then we start to see some upticks. So when I think about like despair communities, right, quite often, smartphones and internet and, access to, or even the lack of fear to go get that education, right? Do we have to, when you talk about post-acute care and all these things that are available, and even Joe, when he was here the other week, hospice is a benefit that we all have. Like, how many people know this? How do we get people to understand before it's the point where they're having to make decisions that, could impact the quality of the rest of their life, could shorten their life, could mean that they don't see their family in their last days? How do we educate people in these communities, specifically the ones we're talking about, so that it's not end stage type of decisions?
You definitely have to go where the community feels comfortable, right? Like, I think I talked to you when I worked at a hospital in the Compton area. We were successful in implementing a lot of programs to help the community because we went to the community. That means educating barbershops, right? That's where they go.
So, like, I hope people are listening, because when we went to Orange County Chamber of Hispanic Chamber of Commerce, and we asked them, what do we do?
Right.
They were like, go to the boxing gym. Like, literally, same thing you're saying.
Yeah.
Barber shop, go to Northgate.
Yep.
Things like this. Go to the schools. So great advice. Like, you got to go meet people where they're at. You can't expect them to come in and get this magic.
Exactly. Right. Yeah. So you have to go there. When I worked at a behavioral health hospital, we will go to shelters, right? Because that's where you will find, the homeless that might need care, right? So you always have to think of where are they, where they feel comfortable. And after that, they educate themselves, right? It's also providing a lot of educational lectures to them in a way that they feel comfortable. Sometimes you feel more comfortable with someone that you can relate, that looks like you, right?
Super important.
So if you go to a Hispanic community, having a Hispanic person going there, educating them, they're more comfortable with, like, I trust you. I'm going to go take care. I'm going to educate myself. I'm going to spread the word.
Yeah.
So you always have to think about that. Meet them where they are.
I don't know what to say about that. I have a lot of thoughts on that. So I'm married to a Filipino. I have Filipino children. I've worked in an industry that is surrounded by this beautiful culture. I really appreciate the Filipino culture. Since I've got into healthcare, had this ache to see more people of color, of different colors, I should say, in the healthcare field. Because, like you said, when I go into dialysis centers, because that's where I've always been. And again, I'm married to a Filipino. I have Filipino children. Paco's one of my best friends. He's a Filipino guy. But when I go into a dialysis center, I see all Hispanic, Latino patients and Black patients, and I see all Filipino care workers for many years. I'm starting to see a shift. But like, I opened a business years ago, educating, and one of the things I really wanted to see was an increase in the population of students that I had that, looked like the people I grew up with.
Right.
And the people that are sitting in the chairs. And we're starting to see that. I think that there's a misrepresentation, a disproportionate allocation of the people that look like each other, sitting in chairs and beds, and who's taking care of them. But then when I took the next step and became an entrepreneur, if I can call myself that, and went into business and started doing things like operations and stuff like this, I found even less. And I remember a show I went to, maybe, what's the year, 2010 or so. And I was speaking. It was a professional organization, nephrology organization. I was speaking on, like, interdisciplinary teams in nephrology. And this guy came up at the end, and he's like me. He's like bald, like shiny head, right? He's a buff guy, like looks like a biker, but he's in a suit. And he's like, hey, man, I have to, it's like, he's like all excited. He's like, that's the best. I know he was just like blowing smoke up my ass, but the reason why he went to that, he's a biomed. I was talking clinical stuff. He was like, I looked through the schedule, and there was only one Latino last name, only one. So I came because we're the only two here. I still my friend David Ramirez. He's in Texas, a badass biomed operator. But it really, we clicked, and I found others over the years that kind of did it. Sometimes I feel bad because it's like, well, why are we clicking? Well, because of that. But at the same time, like, I grew up with a lot of pride in who I am, right? And I think everybody should. So, from entry into a healthcare field to, you're making waves, and obviously your perception on how to accomplish things, I think people need to take notes. It's probably best practice at this point, and maybe people are taking notes. But I talk to kids in healthcare career pathways. I have a business that trains people, and I often get a chance to mentor them every now and then. We go to high schools every now and then, talk to kids, these sort of things. Maybe it's not a high school kid. Maybe it's somebody who's just trying to level up, right? What lens can you speak to? You know, you're a Latina woman in Los Angeles coming from Calexico. What can you share with us that is going to make us run those rungs of the ladder, and not get bogged down with, I guess, the nonsense, but also not lose ourselves? As you know,
Right.
I think you shared a little bit with me that, you know, there's kind of like, you got to make sure you're still yourself.
Powerful question. And I think all of us need to help each other. You're going to have to help each other, right? Together, we can accomplish a lot, right? It means helping each other, helping, you know, someone that is, if you're Latino, help a Latino. If you are a minority, help your minority, right? Because together, we're going to accomplish a lot. And it's called, I was talking to someone as I was coming into from a student in growing in my career and to where I'm now. It's called helping someone get in the train, right? Someone helped you get in this train,
Yeah.
right?
Lift them up, right?
Lift
Yeah.
them up.
Yeah.
Help someone. We all have different stops along the way. Not everywhere is going to be on the same end of the stop, but help them. And that's how you're going to see a lot of more representation of minorities, Latinos getting, you know, moving in positions, in higher positions of power to influence, to be able to, when you are an executive and you have a patient, they're going to feel more comfortable going into your facility because they relate, because you understand them, right? Our cultures are different, right? Every culture has a nice foundation, but sometimes we're a little bit different by the way we think.
Yeah.
The way we do things, the things we believe. And sometimes that is lost, right, in the process. Being able to relate, right? So when someone's talking to you, you understand where they're coming from. And I think all of us, especially me, as I was moving into this ladder where I'm now, I had to adjust myself to be from a very strong, you know, the way I spoke was different, right?
Yeah.
Like I said, my Spanish is my first language. I learned English. I had to learn proper grammar. I had to learn how to communicate to be able to fit into these roles of executive, right? To be able to grow, because that's what's required for you.
Yeah.
But along the way, you kind of lose yourself and you have this feel of imposter syndrome. Like, do I really belong here?
I know it from here.
Right?
When I did this, I have big time imposter
syndrome. you have to believe in yourself, right? Because you have to remember that we are making waves. We are starting foundations for the future, right? For the next generation of Latinos, the next generation of minority. And they have to be inspired, right? If you see one Latino, one minority out there, be like, I can be there.
I love what you're saying. I mean, as you were saying that, I'm thinking about what I just said. It's like underrepresented, even on the staff line, right? And then it's like, well, if we don't have anybody at the top of the ladder either that looks like me, why would I even get into the field?
Right.
You know, like I have nobody that, like, there's a ladder that should be familiar to me.
Yes.
And I'm not, you know, somebody that, like, again, I have pride in my heritage, and I think everybody should. I'll say it, you know, we should be less scared to kind of be proud of who we are, and not shy away from that pride because we feel like we're stepping on somebody else's toe. It's okay.
Yeah,
To be proud of yourself and where you come from and the language you speak and the color of skin they have and the clothes that you wear or the jewelry. You know, it's okay, right?
Exactly.
For me, when we were chatting before, I was thinking about my family, and my family's from Peru. And, you know, my grandma, she's above 85, demented. She can't cook anymore. Like, she used to be man, like now if she cooks, it's a hot mess, right? I got a cousin that's still, you know, she's a badass cook. I got a couple cousins around here. My kids are half, you know, me and half my wife. So it's like Filipino, right? They don't know how to cook Peruvian food. So I don't know why I was thinking about this. I was like, when I die, when all the matriarch women in my family die, like the Morales name in the United States won't even know what Peruvian food tastes like. And I'm like, holy shit. Except for they go to like, what's the place called over here? now I can't Orocoto or, Inca Grill or something like this, right? But that's not the same. It's like if you go out and eat Mexican food, it's not the same as what you had, right?
I think we have to remember too is like talking to the topic of like you kind of lose yourself as you're progressing in your career, or if you strive to be bigger, you might lose yourself a little bit.
Yeah.
But you kind of have to remember of your roots, where you come from, and part of that is taking a dive into like learning how to cook your culture.
Yep.
And
you might even be sick of it by the time you figure that out, right?
Yeah. But as well, making if that means like having Sunday dinners where it's just one specific, that way they don't lose themselves, because I think like you made a point is at some point that's going to be lost, right? And it's up to us to make sure that we kind of carry over that culture to our children's, everybody else. But you have a great point. We kind of lose ourselves there, but we have to remember where we come from, and having, connecting with people. For example, I'm also part of the Latino healthcare executive, and kind of helps me reconnect with my own culture.
That's cool. Yeah.
So
I gotta start hanging out with you. Seriously,
let's hang out.
You're
I
at
know
like
all
all
the
the cool
people.
spots. Yeah. I mean, these are groups that I think everybody should be looking at, and I'm gonna actually do this. I looking at your LinkedIn profile, right? Sorry, I just gotta be a nosy person here. The accolades go over and over. Let's see if I got you. There we go. So what's in here? Do you have that listed in there? The Latino organization, the Latino Healthcare Executives?
You have to carry.
So right now, is this your position? No, this is not your position right now with ACHE. What's your position with ACHE right now?
I'm the chair of Board of Governors exam, so I helped everybody pass
to get that
fellow.
Yeah.
Anybody who's interested in becoming a fellow for ACHE,
Well, what does it take?
Whoa! So
the classes are like what?
It's a rigorous process, so it takes a while to get there, right? You have to be a member. You have to take a lot of curriculum like classes. That's about 35 classes
through the organization.
And that could take you up to like 2 years just to get those classes, because they offer you like face-to-face or education. And as well, you have to do community service. That you have to study for an exam that's a 6 hours exam.
So this is for like executive type of people, though. These are not. Some of them are clinical people as well.
You can be a physician. You can be a nurse. You just need to have the requirement of having a master's degree. Doesn't matter what. But we do have a lot of physicians that take this exam, become fellows. So,
but you know what I love is like even if you're not a clinical person, you have to do the service component of it.
Yes.
Man, so many people in business need that, and not just healthcare, right? Like go do something for somebody, right?
Yes.
And that's one thing I really appreciate about nursing as it was. I don't know if they're as strict on it anymore, but like the volunteer hours, the service hours. That's a huge component. I hope this is not offensive, but I when I look at you from the outside, I just see a servant leader. You are willing to be in the trenches and lead that way, and more of us need to be that way, right? I mean, when you go into a nursing home, when I ran one, half of the LVNs probably never did the level of care that the CNAs did. So when things happened, it was like, oh, my CNA. I was like, hey, no, I don't do that, right? We all got to be willing to get dirty every now and then, right? And I think from the professional organization, I see you right there in the trenches with it. I mean, you're part of the examination process, right? I'm interested.
Yeah,
I'm interested. I need something to do for the next few years, so.
Yeah, I'll get you busy.
And then conferences, and I have a daughter that's also getting into she's a nurse, but getting into more the business side. And I'm really encouraging her to participate in these sort of things as well. Find examples. It's so easy to get caught up on like, I have to stay bedside, but there's especially like LVN, right? Like they can do so many things, like from case management to the MDS to run an op, right?
Right. And part of those organizations and connecting, right? Part of networking, it's a benefit.
Yeah.
You meet people that have different journeys, right? You have people that started as an AVS and they're leaders.
Yeah.
Started CNNs and they're nurse leaders, right? They all have a different journey where they to get where they got there. But it really connecting with them really helps you with like, what else can I do? Or where does my values or what brings me joy aligns with that? Because sometimes in the journey, you're going to discover what I thought I wanted to be doesn't align with my goals.
Yeah.
So it really helps you with that, like connecting with someone that's willing to tell you their journey.
That's
And as well,
powerful.
bounce ideas.
I think especially for those who are like trying to find it, like we're so scared of doing something wrong, and like that's probably the best thing you can do. Like screw it up.
Yeah,
Do something.
that's how you learn.
Yeah, I mean, you find something that's going to carry over, right? You think about Steve Jobs and dropping out and taking calligraphy and crap like this, right? And it's like, oh, it came in handy, right? I've been accused of, and it's probably true, like doing too much, like getting my finger into too many things. I have the mentality for that, but like, something I was thinking about when you organize all these things, right? And like I heard you want to help people hear, educate, things like this, right? And that's what we're doing here. We're trying to help people to hear more stories, right? And hear the pathway, they don't want to follow. Hear a story that's going to impact their life, right? But I got to admit, I'm super selfish too. I'm sitting here learning everything from everybody who comes through here, and I'm just like, I'm absorbing it. So like you're giving me gold today,
Yeah.
on several levels.
You gotta spread the word, spread the knowledge. That's where, I am a true believer, and it goes back to the foundation of my mother is you want to do good, you want to do big things, you want to do it for your community, right? So you want to be impactful. How are you going to be impactful, right? It's educating someone else to make better decisions. So definitely share the knowledge. Healthcare, there's a lot of information in healthcare. It never ends. There's new information, new updates, new resources, new innovation that we can all benefit with that.
So let me ask you from the post-acute transitional care. I know you work with a lot of equipment as well, and I think currently that's a focus of your role, isn't it? Like making sure that everybody's got what they need wherever they're at. Is that the right way to say it?
Yeah. So in post-acute, right, we're talked about the different levels. There's different niches, home health, hospice, skilled nursing facility, so on. And one of the niches as well is durable medical equipment.
Yes.
And you never thought that's part of post-acute, right?
Right.
You just think someone's being discharged by, how does all the other stuff come to their home? So durable medical equipment is a key element in all of the care continuum, right? You need, when you're moving the patient cannot go home if their equipment is not at home, right? They're going to stay wherever they are put. Because you're talking about oxygen, you might talk about wound supply, CPAP, BiPAPs, anything they need. Bed, a wheelchair.
What about the ramps too, right?
The ramps, right? So it's a lot of, so that's a huge niche that I have been able to tackle now and learn more. So I'm diving into that too.
I mean, is that included? So when we talk about like the industry of healthcare and the total market value, like what does DME look like? I would imagine that it's some stupid number that like,
crazy.
Like would make us all just drop our jaws.
Yes, it's really high. If you guys, if there's any entrepreneurs out there, I would say
It's a place you want to get in.
You want to get there. Yes, you need DME for any discharge.
So when you say entrepreneur, where's the money for them? Is it in distributing? Is it manufacturing? But
do both.
Both.
You can own both sides too. But you definitely you have to, every skilled nursing home, any post-acute care agency or any stop along the way, it's going to need DME.
Yeah.
So it's huge.
Yeah.
Especially if you're talking about dialysis too, right?
Can we go down that road a little bit?
Yeah. Try me.
All right. So these are highly complex patients. These are highly complex individuals. They have comorbid, and take the patients, because I really hate when I catch myself calling people patients. They're people who need care, right? Their needs for care is highly complex. Dialysis is like the tip of the iceberg, right? In most cases. They've got issues with their endocrine system, hormones, A lot of times diabetes, high blood pressure, you talk about COPD and CHF, and then we tack on sometimes behaviors and mental illnesses and things like this. So, I mean, when you stack up their comorbidities, there's a lot there, right?
Right.
They're frequent flyers. In your experience, you see them in the hospital quite often, even if they're being in an outpatient center dialyzed, you see a lot of them coming back into the hospital.
Yes, we do.
For what reasons?
For missing, if it's called chair time,
Yep.
right? If they miss their appointment. So
Yeah.
it's very important that these dialysis patients go to their appointment on time,
Yep.
right? When they missed their appointment for one reason or the other, they go into the hospital.
Yeah.
When they have to supply a chair time at the hospital, which could be very costly.
Right.
Right. And then we're having another, which is frequent flyers because you see them in the emergency room.
Yes.
Then the next challenge is when you plan of care, when you're going to discharge a patient, you need to have a plan of care. That means their follow-up appointments, what's going to be their end goal of getting better, where they're going to go next.
Yeah.
Do they have the resources?
Yeah.
How are you going to get there, right? It's like a long variation of that. And part of that is securing their chair time.
So that was in some of these roles, some of your responsibility was to secure that chair?
It's more in the administration side to making sure that, for example, the care manager, the
Yeah.
social work, that they're collaborating to make sure that is happening, right?
Yeah.
If it doesn't happen, why is it not happening?
Yeah.
And a lot of those delays of discharge will be finding that chair time,
Yeah.
and making sure that they go to their appointment. So this falls into the aspect of transitions of care. So in the hospital I worked with before, we had a transitions of care team, and our goal was to make sure that after a patient discharge, we're calling them to make sure that they go to their appointment. That means did you go to your dialysis appointment, or reminder, you have a dialysis appointment coming up. Do you have transportation? Sometimes that's the challenges that we see with patients, that they miss their dialysis appointment because they didn't have transportation.
Yeah.
They didn't have a reliable one. They might say they do, but it's not reliable. Sometimes it's talking about a bus, but they didn't have the money to pay for the bus trip.
Yeah.
Right? So it's how do we get there? And this wonderful hospital had the resources to say, okay, this is a challenge. Let's find you a way to get you to your dialysis appointment. That is, maybe we pay for the home health to get you, transport. Or maybe is we find a way to find a different transport to get you there. This hospital was so innovative that I even thought about maybe we should open a dialysis center to make sure that we have those
Yeah.
chairs available,
Yeah.
because we do see those frequent flyers into our communities, right? Because they miss that.
Yeah.
But then we go back to the challenge of who's going to pay,
Yeah.
right?
Yeah.
It's very costly.
Yep.
But this transitions of care teams with follow-up appointments and making sure that you go to appointments really helped
Yeah.
kind of manage that. But we do see those challenges there.
Well, thinking about like those MA plans, right? When just what you just told me, okay, patient can't get to dialysis. All right. Quite often, the transportation's being paid for by the payer, right? It might be non-emergent. It could even be a gurney ambulance, which would be very expensive
Right.
both ways to and from dialysis, right? So, thinking about kind of the here and now, but also I think innovative thinking is like, okay, if we have identified patients that are frequent flyer in the hospital, and some of those are because of actual underlying health issues, others are they just miss treatment, they need to go to the hospital and they're
Right.
getting a high cost treatment now, right? Or a high utilization treatment and taking up bed space or ER space or things like this, right? What about keeping them home and paying some money for somebody to go to their home to avoid those transportation, to avoid the hospitalization or the readmission, and the impact that it has on that entire ecosystem, because hospitals and nursing homes are penalized for readmissions, right?
Right.
So do you see that as one of the possible, I don't want to call it a solution, but one of the possible tactics to reduce the cost of care and avoid those misses and those hospitalizations?
Yes, 100%. And again, it kind of goes back to the the model that we're all aiming to go to, which is care at home,
Yeah,
right?
yeah.
You can provide that dialysis at home,
Yeah.
which is going to be a lot better. You don't have to worry about missing that appointment. You
Yeah.
don't, you can even have, it's easier to balance your life. Like
Yeah.
you can still have a job,
Yeah.
right?
Yeah.
You can
Yeah.
have your job and you still get your
Well, you don't got to
dialysis
go to
treatment.
center, and then you
Exactly.
don't got to come see me either, like, which is a big plus. Like, I always tell that to the people I mentor. It's like, you think anybody wants to see you 3 times a week? No. So, being that they're forced to do it, like, you better be somebody that they can tolerate, right? And that's therapeutic in their life, and not like, oh, there's Mirna again. Like,
Exactly.
I
It's
don't
like,
know.
oh, God.
Yeah, that's not a good feeling. Like, I got to come here every 3
Yeah.
days, 3 times a week for the rest of my life and see this person that I can't stand. That's a big, I think, responsibility on us. I'm curious, what are the big challenges? So, like, if we take care out of institutions or out of facilities and do it at home, and we take people to their homes, and I've heard stories from home health nurses and hospice nurses and things like this. I went into that, oh man, disgusting house, right? Or Mr. Jones was smoking crack in the house, or the sister lives there and she's screaming at me to take off my shoes, or
Yeah.
they have dogs and I'm allergic to dogs. Like, what sort of challenges do you see from the people from us, right? Because we're people too who got to go
Right.
out to the homes. Because that's the hardest part, isn't it? Like, managing people.
Yes, I think we know managing people is the hardest. And being compassionate, kind of stepping back of like, we're stepping into someone's home,
Yeah.
which is a completely different world than what we live. in.
Not your rules anymore, right? Not our rules anymore.
No.
Yeah.
So and I give a lot of kudos to all the nurses, anybody that chooses to be home health and hospice, that your job is to provide care in someone's home, because it takes a special person to be able to be like, I am no longer, putting myself first as my patient. That means if my patient wants me to take off my shoes, I'm going to do that.
Yeah.
Yes, we're going to be facing challenges of someone maybe screaming at us, but where are they screaming at us? Maybe it's the way they communicate. Maybe we need to have a different conversation or expectations with them. But a lot of people do get scared because of that. And it's okay. It might not be your environment. It might be someone else's environment that is willing to give back in a different way. So it really takes a different type of person to take that challenge with a different type of skills as well. But I think our part's to it, education, right?
Yeah.
That we have to be compassionate to our nurses. So if you're going to have someone come into your home, be compassionate that they're doing this from their heart, and, thinking differently of being more compassionate. So compassion in both ways, really, is what we need.
Do you think we have a gap in the workforce to be able, like, let's say the entire delivery of care shifted to home, like all of it, man?
Yes.
Do we have a gap?
Yes, we do. We have a huge. I think we're all facing with nurses.
Yeah,
shortage.
I was gonna say it's already just absolute.
Absolutely, is it theirs? But adding another layer, right? When you're as you're moving with a model of care at home, you need a different type of nurse with different type of skills. You need, for example, it's a nurse that has, for example, ICU med-surg skills that is comfortable enough to provide that at home.
Right.
And that takes a lot of training, right? And a lot comfortable with it. So a lot of hospitals are trying to cross-train their nurses to be able to apply those skills at home. But we definitely do have a gap in not only nurses, but in different levels.
Yeah, skill set and
Skill
specialty
sets.
and all. Yeah. I mean, I know on the home dialysis side, it's like, yeah, let's do it. But there's not very many people that can actually train patients to do it at home. And then when we talk about going to people's homes, the reimbursement system is not been set up for it yet.
Yes.
I think we're having the conversations to get there, because it's like, if I've got 1,000 patients in my plan, and 30 of them are costing the same as 500 of them because of all this stuff, right? Missing treatment, transport. Like, let's do something about those, and really impact our bottom line at the end of it, right? So I see, I'm hoping that home dialysis is going to take. There was a time with dialysis that 40% of the patients were doing home dialysis. Today we're like less than 15%. And when we talk about hemodialysis, it's like 2 or 3%. It's really, really, because it's not easy. And then you got to put needles
Right.
in yourself, right? So it's super intimidating.
Yeah, I think it's a lot of training, right?
Yeah.
You constantly you can never stop training someone.
Yeah.
Because, the wave might pass, right? You always constantly, just like with staff, right? You have to constantly refreshing them with training, refreshing them with the community to know that service is out there, that you can provide. There are resources out there that they can provide dialysis at home, which is
Yeah.
a lot more comfortable. You can think about it. You can have dialysis while watching your
I grew
football
up with a
game.
home dialysis patient.
Yeah.
I literally grew up, like, since I was born, my uncle was on dialysis. He passed when I was like 32, 33, but he did it at home most of my entire adult life. He put needles in himself, and that's exactly what it was. It's like, do you remember TiVo?
Yes, yes.
So God, I hated it. He was like, what is it, Two Men and a Son, or I don't remember, something like Charlie Sheen, and like he would record these things.
Oh,
2 minutes.
2.5 men.
2.5
Yes,
men.
yeah. Shows like this, right? He had these shows, and it would be like, okay, time for dialysis. We'd set him up, get him on, and then it'd be like, okay, he's popping TiVo, and then it'll, go get me my orange. He's not supposed to drink orange juice, but on dialysis, he would take like a glass of orange juice that was half full, frozen, and then he'd fill up the top, and that's all he would drink, because oranges have a lot of potassium, which is good for me and you. But for a person on dialysis or kidney failure, if they have a high level of potassium, it'll put their heart into like distress, and they could go into an arrest. But so he would do things like, he kind of plotted his own way. Like you said, it was comfortable for him because he would eat stuff that you're not supposed to eat if you're a dialysis patient. But he knew when to eat it because he was going to dialyze on his schedule. Growing up, he did a lot of stuff with me and my cousins, like on weekends, weekend trips and stuff like, oh, I'm going to dialyze, one extra treatment before I go on the weekend. So it was really, he didn't miss a lot of steps until decades on the treatment and the toll it had on his body. So I'm curious, Mirna, you see, so together, like your role professionally in transitional care, DME, doing all this stuff. And some people might go like, there's only 24 hours in the day, right? So like, it feels like you got a lot of face time, like you're always in front of somebody. Do you stress sometimes?
Do I stress?
Yeah.
Oh, yes. Yes. I think during COVID, I think we all really learned about what we value. So when you met me, I was really involved in a lot of organizations, doing a lot of events, going to a lot of networking events, which was helpful for my career and growing. But during COVID, it really made it very clear that you had to balance. And it has been a journey for me to balance, because I have, like I tell you, to be big, you got to take challenges, you got to do things, and a lot of things fascinate me. I want to learn. So I have a tendency to do a lot.
Take on a lot. Yeah.
But I'm also able to manage it. So it's being able to, I'm a good organizer. So as you probably saw, I organize a lot of conferences, a lot of events. So I'm able to organize my schedule where I'm able to balance a lot of things. But it does get to a point where I get stressed, right? Because I do have my regular job that I do as well.
Yeah.
And that could be stressful enough.
Yep.
It's doing a lot. I mean, for me, it has helped me is exercising. So I started exercising. I dance. So I'm a huge fan of dance.
I'm surprised he didn't make any noise.
Taco, we can go dancing sometime.
Mike needs to exercise every time. Like, look at this thing.
No, because I mean, I've reminded that.
So it's finding little ways where it brings you joy. So dancing is one of them.
What kind of dancing do you do?
I dance tango.
Oh, wow.
I dance tango, salsa, merengue.
Oh, so you know all the stuff that like gonna make everybody feel stupid if they dance on the floor. That
I'll teach you guys.
Like,
I'll teach
don't
you.
go on the floor. Mirna's here, like she's doing all these fancy stuff. Like, that's awesome.
I love it. So yeah, it's doing that and reading, and reading outside of healthcare. So I liked reading a lot of things that, for example, how to think big, which I already do, but how to make executing it. thinking about how to stay positive. I started meditating.
Yeah.
Meditation has really helped as well. So life balance, it's something that we all need. And I've seen a lot of people in high positions, stressful positions that kind of break.
Yeah.
Because they don't have that balance. They don't have that ability to kind of let go.
Yeah.
Because at some point you have to let go.
Yeah.
And another thing too is you need to have a good support system. Like if that is friends, if that is your family, to just have that conversation, because sometimes you want to vent, but it's like, you have to be-
So let you got me. Like, what do you mean support system? So do you want somebody to go like, yeah, you're right, and or do you want
No.
somebody to go like, bullshit, like don't do that, like that's not a good idea, or do you want both?
I think it depends on the person. For me, I have a good support system that tells me real. What is real?
They don't tell you what you want to hear. They
Yep.
tell you what you need to hear.
What I need to hear.
Yeah.
They're real. They bring me to ground. They tell me you're thinking about this a little bit too much, or your expectations are a little high. You gotta kind of lower it to make sure you're compassionate with other
Yeah, yeah.
people. You're doing too much. Sometimes you need someone to help you ground yourself.
Yeah.
But that really helps, and also to let go. Like those people can help you. Like, hey, let's go and have, something. Let's do this something fun, or let's happy hour and laugh, because you really need to laugh.
Yeah.
And I think that's something that we all need to do. Just laugh a little, let go.
See, I told you I'm selfish. So when you describe like doing too much and not having, like, that's me to a T. And like, I feel like I can manage it, but in reality, like maybe I can. But like, this is not a secret on the podcast.
Yeah.
Like my body knows that I'm not taking a break. You know what I mean?
You gotta rest.
My mind, man, I'm driven. I don't lose like focus. I don't lose intent, but it's not even about rest. But like, if you would have saw me like a year ago, or 2, 3, like the way my body looks different, right? And that's because of work. I don't do enough of the release of exercise, which I'm trying to. By the way, I lost 12 pounds. I told them I was going to do
Good
that.
job.
Lost 12 pounds since we had a
Congratulations.
chef on the show.
Congratulations.
And I'm going to keep doing it. So hopefully, like, you can see it from this side. It's only this big now. It's not.
It's your posture.
But I think we all need to take heed of that. And I'm 46, and I'm going through exactly what people at 46 are going through. It's like, hey, you want to be 70 when you're 50, or you want to be able to, like, I don't know. People at 50 these days, they're still like running Ironman.
Oh man, I know.
Right.
I've seen them.
Yeah, we had a guy on here, Egan. How old is Egan? 52. And the guy is just ripped and like, deadlifting and squatting. Like, he's a mixed martial artist guy, right? So, okay. So you've got some things to kind of de-stress, but
Yes.
I want to go back to stress. So like, okay, doing a lot of stuff can be stressful, and fast pace can be stressful, and people expecting things can be stressful. But I think you got all of that. What keeps you up at night though? Like, what makes you go like, I'm not done?
Wow, great, powerful question. What keeps me up at night is thinking, what impact have I made today? Right? Sometimes we lose ourselves with, I gotta get this done for my job. I gotta get this done. But what kind of impact are you making to the world,
Yeah.
to people? Right? Have I made an impact to the person I connected today? Like, have I helped him in some way? And that's what keeps me at night, that I want to make sure whatever I do, I'm making an impact, if that means a little impact or a big impact. Like I said, I'm a huge advocate of doing good for the community, doing big things for the community. And I think we all need someone to kind of give us hope in one way or the other. And I always want to make sure whoever interacts with me at some point has some sort of hope to dream big, or to be motivated, to believe in themselves. Yeah.
So I gotta tell you, like, I didn't pay Mirna. I didn't prompt her, but one of the prevailing themes of the businesses that I owned is dream big. And I mean, to a campaign perspective, like, that's what we're really focused on, is, getting to people, whether they're they don't know what they want to do, or whether they're doing something that is not enough for them, or that's not rewarding enough, that keeps me up at night as well, Mirna, is like, what's my impact? I have 4 children, I have grandchildren, so I want to, that's keeps me up a lot. Like, what impact have I had on their lives? But on a broader scope, like, I feel like I was put here for a reason. And, all the bad stuff that I did brings me closer to people. When I went out to the clinical side of things, I fell in love with healthcare by doing it. I never wanted to. But I fell in love because I could see the people in the chairs, like my dad. Like, he didn't make good decisions in life, but they didn't make good decisions in life, and I didn't care. Like, hey, I can still take care of you even though you're a drug addict, or you have a criminal record, or you didn't make all the right choices in life, right? And then I have the experience with my uncle, who was sick but didn't let that stop him. So, like, sitting there in front of people who are chronically ill, it's most cases not going to get better. I just found myself in a place where it's like, 1, I don't care where you're at, I'll meet you right there. 2, this is not the end of your life unless you give up. And as long as you're willing to try, I'm willing to try. So you have my allegiance in all of your agendas. I'm so thankful for you coming here this evening. Thankful to Joe Rodriguez for, rekindling the introduction. And I hope there's more to come. You have an open seat here. If there's ever anything you need from me, from Paco, let us know what we can do to support the broader vision here.
Yeah, thank you for the opportunity.
Thank you,
Appreciate
Mirna.
it.
This episode has been brought to you by Dialysis Education Services.